you work beside your coworkers, your friends, family, some of you, how quickly could you identify that something was seriously wrong with them? Immediately, 2 hours maybe, 4 hours when brain damage is permanent? Well, today I'm here to talk about your importance in the role of identifying signs and symptoms of a stroke that could present while you're on the job, because time equals tissue or time equals brain. Just like time equals crude oil if you have a leak on the pipeline. See, your brain is not unlike the large pipelines pushing crude oil through that you track on your computer daily and walk the lines to see if there's any leaks that's interrupting flow. I've heard the saying, open before you close, and the importance of having an open pathway before you close another one down. So what happens when you don't? As a trauma emergency nurse at St. Francis in Tulsa, we see multiple strokes a day. Some of them are minor. They might just affect your vision and resolve with medications. Some are massive head bleeds that individuals are unlikely to recover from. But the most important thing that we focus on is going to be the patient's last seen normal and how quickly they were evaluated for a stroke so that we can start giving them treatment. The American Stroke Association shares that stroke is the 5th leading cause of disability in the United States. So today, I briefly want to cover the 2 types of strokes and the treatments, risk factors for strokes, and signs and symptoms, and your important role of identifying those. So the 2 different types of strokes are going to be the hemorrhagic or brain bleed and ischemic or blood clot. In a brain bleed, your blood and oxygen aren't getting where they need to go. Just like when you have a leak on the pipeline, your product isn't getting where it needs to go. And you lose pressure. In an ischemic or blood clot stroke, again, blood and oxygen aren't getting where they need to go, much like when you forget to open before you close. In a brain bleed, you can see different things like increased confusion, seizure-like activities. Sometimes the pressure can become so great that our body's natural respiratory drive shuts down and it leads to cardiac arrest. So the treatment for that is going to be symptom treatment. So we can give a plasma infusion to promote clotting. We can give seizure medications to reduce the risk of seizures. We'll lower the stimuli in the room so we don't increase intracranial pressure. And sometimes the doctor will opt for a possible craniotomy or taking out a piece of the skull to allow for swelling. In an ischemic stroke, we can do 2 things. We can do symptom treatment and source treatment. So we're going to make sure that your blood pressure comes down because your body's still going to want to perfuse the brain past the clot. We'll give you seizure medication, and then we can do a clot busting medication. However, there's approximately 20 absolute exclusion criteria and 20 other exclusion criteria that they'll take into consideration based on the patient and where the clot is. The most important exclusion criteria on that is going to be the 3 to 4.5 hour window that we need to be seeing the patient and starting that clot busting medication. Remember that symptom onset plus getting the patient to the hospital plus doing a whole stroke workup takes time. So that's why it's so important to be able to identify the signs and symptoms. We can also do clot retrieval, which is kind of like a roto-rooter for your brain vessel. We can do that 24 hours after symptom onset. However, that can only be done with large vessel occlusions. So this is a subdural hematoma bleed. This is not one of my patients. I had a really good picture, but I lost it. But you can see the blood here that's collecting. It's pushing the brain over. This is supposed to be our midline. You can see that it's starting to shift, which is bad because at the bottom of this dark area is our brainstem, and we don't want to interrupt that because that shuts down our body's natural will to live, basically. So the CDC states that stroke is the leading cause of death that's preventable and treatable. Bearer of bad news is that the risk factor list is just as long as the exclusion criteria list for treatment. I listed a couple. Some are genetic risk factors, but most of them are lifestyle choices and their consequences. If we want to rid ourselves of the complete risk factor, we would have to do a lifestyle overhaul, not just a lifestyle change. If we get rid of smoking, our uncontrolled hypertension could still cause us to stroke out. But any lifestyle change is a good one. A couple of things that you can do to lower your risk can be compliance with doctor's appointments, compliance with medications, lower your stress level, get your labs drawn yearly, make sure that we know what's going on inside of you. So I want you to remember the acronym BFAST. Some of you have probably seen the FAST acronym, face, arm, speech, and time, but the American Heart Association wants us to use the BFAST because it encompasses both types of strokes as well as some posterior strokes that affect balance. So the B for balance, we're going to be looking for somebody that might be leaning over in their chair or in a vehicle. They're going to look uncomfortable, but they won't say anything. They're going to have trouble standing up and walking around. They might look like they've been drinking. The E for eyes, we're going to look at their pupils. We want their pupils to be the same size. If one is bigger, that should send alarms off. That can indicate a brain bleed. For the face, we're going to be looking for any drooping. So we might have them smile at us and raise their eyebrows. And we're just looking for that one side to kind of droop down. For the arms, we'll have them raise their arms up like this and look for any drifting, weakness, or complete paralysis. For their speech, they might sound slurred, or they might have some word salad, or we call it aphasia. They might say something like, "But raccoon to left of fridge," and they'll say this with confidence, and you're still going to be like, they're trying to tell me something, but I don't know what they're trying to tell me. So if you, your coworkers, or your family have any of these symptoms, go ahead and skip to time, because time equals brain tissue, and it's time to seek medical attention. I don't recommend driving them yourselves to the hospital, and I don't recommend going to a primary care provider because this is an emergency and it should be treated as such. So even though you might not know the difference between an ischemic or hemorrhagic stroke or remember any of that that I talked about, just knowing that the signs and symptoms paired with fast action could help save your coworker's life from becoming robbed. And that's it. That's all I've got. Time equals brain. Yeah, be fast.
Okay. Well done.
Good job.
Thank you. Thank you. That's